There are certain things we look for at certain ages. So in the newborn period, the child starts regarding the face. The vision is developed in the newborn period itself, and the child can see the objects which are nearer to the baby. So the focal length is adjusted in such a way that the baby can see the mother's face clearly while they are feeding, and they do have color vision as well. So it's very important that we assess their visual assessment from a closer distance. As the child matures, binocular vision develops and distant vision develops as well. The child starts responding to voice. There may be primitive reflexes like sucking, swallowing, rooting, development of the grasp, and other reflexes. So these primitive reflexes tend to wear off as the more advanced reflexes come on. So the loss of primitive reflexes is a very important aspect of child development as well. The gross motor development in the first year, you achieve head control by 6 to 8 weeks, and by 4 to 5 months can start sitting with support and can start turning from back to side. By 6 to 8 months, the child sits without support and can roll from back to stomach. By 9 to 10 months, the child can crawl and start standing with support and walks by 12 months. So this is the sequence, so rolling over and going on the knees, sitting, and then they can start standing and walking. So the stage of development can guide you in terms of what you should do for the child. So when the child has started sitting with support, you start considering a high chair. This is usually the time we start weaning the child, so it would help you with the feeding as well. When the child enjoys sitting with support and looking around, and they start developing more, the stimulation is more, of course, not to watch television. Avoid the baby walker. There is really no benefit, and it can cause harm by accidents, or it may cause slow walking. So they may have a delayed walking. So avoid the baby walker. You have more developmentally appropriate toys according to the age. In terms of vision and fine motor in the first year, you have fixing and following by 6 weeks, and by 4 to 5 months the child reaches for toys. By 6 months they reach for toys and have a palmar grasp. They also start transferring from one hand to the other, and they start putting the toys in the mouth. By 7 to 9 months there is a crude pincer grasp developing, and by 12 months there is a fine pincer grasp. So these are very important milestones, and by 12 months they start releasing objects as well. So the pincer grip is where the child can particularly pick with the thumb and the index finger, and very small objects can be picked up. The language, in the first 6 weeks the child engages in vocalizing, 3 months cooing and laughing. Remember that even a deaf child can start cooing, and that's a imitating performance. By 6 months the child babbles, more complex sounds can turn to sound, and by 9 months there is 2-syllable words like mama, dada without meaning, and by 12 months there is words with meaning.